Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Kreb cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. And now, here's Dr. Bradley Block.
Adam Rosh, thanks so much for coming on the podcast.
It's great to be here, Brad.
So first, let's talk side gig. All right, tell us about the origins of Rosh Review.
So it's interesting about the origin of, some people call it Rosh Review or Rosh Review. Either one works. The origin is really one of irony. And to really understand, you have to go back to kind of some personal struggles that I had and some failures that I had. After my second year of undergraduate college, I had a 2.1 GPA. I was on the verge of probation. And, I had a moment of reflection and trying to understand what I really wanted out of my life. I was pretty successful in high school in athletics, and then that all came to an end when I went to undergrad. And so I was kind of lost for a while. And what I realized is I really wasn't believing in myself at that time. And I never learned how to learn. So I think when you combine the idea of someone who wants to get better at something and someone who isn't afraid to look like an amateur at something, that's a very powerful combination. And so at that moment, I had made a commitment to myself that I'm going to kind of redo my own education. And I spent the next few years kind of reading every book I could get, relearning grammar and spelling and vocabulary. And I did all of this because I knew I didn't really have the foundation that I needed. And as part of this, I decided to try to go to medical school because I figured it was one of the most difficult tasks that you could do as far as a career goes. And so I set on a path and got into medical school. And it was in medical school that I really started loving education, loving teaching. And I would really consider, my brain was almost like a hypertrophying, right? I had acquired and accumulated all of this new knowledge and ability to study that I wanted to give back. And so I started tutoring and teaching throughout medical school and into residency. And Rosh Review came about really because in addition to my passion and love for teaching and education, that's number one. Number two, I love technology and using technology in ways to create a wonderful user experience. And number three, I was really scratching my own itch. There wasn't any great resource out there in emergency medicine that provided board review for the residents. And so it was on a night shift where we were all sitting around. The in-training exam was coming up, and I asked the residents, what are you going to be using for your board exam? And there was silence. And that was really the spark, the moment. I remember it very clearly. It was Halloween 2011. That next morning, this was a night shift. I came home and I started writing questions. And those questions ultimately would get turned into a question bank that would go on to become a standard curriculum for more than 90% of emergency medicine residencies, for more than 50% of really most of the graduate medical education residencies, in addition to PA school and nurse practitioner school. So it starts, it's an interesting way to start. And it was really something that for the last decade was one of the most fulfilling and challenging areas of my life.
You took a big leap in time there from going home and writing a couple questions to now test prep for many specialties and nurse practitioners and PAs. So there's a lot in there. So what were some of the building blocks of growing the business?
It was fascinating. A lot of people in medicine are there's a lot of fear in doing something outside of medicine, a fear of not having enough knowledge, not having enough experience, the fear of already invested time in a career. And those are all valid. And when we go through medical school and residency, we're really good at what we studied, what we focused on. I think what was fulfilling for me is that when I started writing those questions, it was apparent that I loved that just as much or more than seeing patients. And I loved seeing patients. I mean, I set out and ended up, my goal was to be a program director in emergency medicine, which I was. And I was a very academic physician. But I realized that there's other challenges in that all of my training was a sunk cost, and that was okay. That the next 10 years of what I was going to do was going to be even more fulfilling for me. And so I was willing to make that transition. And I'm sure we could spend some time on what that transition looked like, because I think that's very important. But the real takeaway here is that all of the skills that I learned in becoming a physician really carried over into building a business, being a CEO, and it's really about being a leader. And I felt that the challenge of developing a team, of running a team, of building a culture, of creating an office, a business that mirrored the type of environment that I always wished I could be a part of in residency and in a practice, right? I had that power to do that. I recognized that, taking on some entrepreneurial role here, that I could build this from the first step, from the first block here. And so the next 10 years were spent making a lot of mistakes, watching, talking to other people and hearing about their mistakes, but really understanding the value of the human, which is what I learned in medical school and residency. And that human being a learner and putting that learner at the center of everything we did. And for my coworkers who I worked with, I considered them just like colleagues, and trying to build an environment, a culture that supported their needs, whether they had a family, whether they wanted to be challenged, whatever it was, because I was still working full time. And so this was really never about the money, which was really interesting characteristic of building this business, because I knew if it failed, I always had a backup plan, which was practicing medicine, which I was just fine with. And so it allowed me to create a business that was truly, I think, unique in the current environment, where we take people's, treat them like real people and, inspire them rather than tell them what to do, right? Motivate them to want to be there and be a part of our company, rather than entice them with, vacation or a salary or whatever it was. Of course, that was part of it, but ultimately, the people who are most committed are the people that believe in what I believed in and who believed in me as their leader. And that was a really special time. It's a really special time to be able to have that opportunity, to have that privilege. Just like it's a privilege to work with patients every day, it was a privilege to build this business with all of my coworkers around me.
You mentioned that there were a couple of missteps along the way, right? Is inevitably going to happen in any business. So in retrospect, if you were going to do things differently, is there anything that you can think of that you would say, you know what, I would have done this instead of that?
I think really hard about this question. And, even to this day, I never look at something as a mistake or an error. I always look at every behavior, everything as an opportunity. And yeah, things may have, had a different outcome than what I had expected, but ultimately it just became a new opportunity. Like Ryan Holiday and Marcus Aurelius, they talk about the obstacle is the way. And I always focused on that. Like whenever there was a difficult question or something that didn't turn out the way we thought it would, we would use that obstacle as the solution, as the path. There was, for example, one organization out there that looked at us as competitors. They were a professional organization, and they disinvited us to one of the trade shows, one of the academic meetings, and that was hurtful because we didn't want to be a competitor. I mean, naturally, yes, we did some of the same things, but we really saw ourselves as a complement to what they were doing, and we really wanted to elevate what their mission was. So we said, okay, we can't go to the trade show, fine. So why don't we? What opportunity do we have? So we put on this was in person at the time. So we put on our own kind of seminar at the hotel alongside their academic assembly. And we chose times that, maybe during lunch or when there were breaks. We didn't want to disrupt what they were doing. And we had interacted with hundreds of people. And so that was an experience where it was disheartening and it was a blow when it happened. But we used the obstacle as the way and turned out to have a very good outcome like that.
Great. I like to have a lot of like brass tacks advice for my listeners to be able to follow. So let's turn it around a little bit and talk about what you learned about learning, right? As one of our roles as physicians, we're teaching our trainees, but we're also teaching our patients. So let's talk about learning techniques and teaching techniques. And a while ago, I had an episode with Chase DeMarco, who calls himself the medical mnemonist, where we learned about different learning techniques that I've never heard of. So if the listener is interested in that, definitely check out that episode. And actually, I taught the graduating medical students from NYU Long Island. I gave a couple lectures to them, and I had a slide about learning how to learn. And they said, oh, actually, we learned that. So in some medical school now, they're actually, when we were there, because I think we're around the same age, we were not taught how to learn, right? But now that's happening. So for those of us, who are a little Gen Xers out there and elder millennials and such, let's talk about how to learn.
That's exactly right. The schools never had formal classes on learning, and I think a lot of the literature really came out only in the last 20 years anyway. And there's a lot of learning theories out there: spaced repetition, interleaving, and they all, there's support for these things for sure. I think when you talk about learning, you could apply. What I love is looking at other disciplines. And I think about learning as no different than athletics and becoming an elite athlete. And how do you become an elite? What's the difference between an elite athlete and someone who just plays, on a high school sports team? And a lot of it is around the edges, or maybe college sports team, let's say that. It's around the edges. And it's the same thing with learning. I think there's general learning where you could pass exams, you could do pretty well on standardized exams, you do well in school and you get what you need, and that's fine. And then there's those who just develop a really strong grasp and intuition and deep understanding of the topic. And those are the lifelong learners. And those are the people who perform deliberate practice, right? Deliberate practice in Anderson's book, I think it's Ars Anderson, Peak Performance in Athletes. That's the differential. It was deliberate practice. It was doing something and then analyzing it over and over again until you do it perfectly. And I think the same thing carries over into learning. So often, I think we've moved away from just this idea of you could read a textbook and highlight it. I think you need to make things, you need to make connections. You need to have a deep understanding. And that's done through there's no one way to do it. But I think if there was going to be one umbrella idea to think about this, it's to be able to not memorize, but understand, to be able to look at the connections on things, and to be able to then, it's okay to read something in a textbook or in a chapter, but then engage with it in a way that uses the classic learning theory of retrieval practice and spaced repetition. So standardized exams are a great example where, you could read a chapter, you could do questions on it, you should document what you get wrong, not just keep it in your mind, but actually write it down. Go back to that documentation, every 2-3 days, because you also want to use this idea of the forgetting curve. When you start studying how we remember things, it's actually by forgetting. When we forget something, what that does is our brain, when we need to think about that topic or that nugget of knowledge, it's somewhere in our brain, but it's fuzzy. It's not entirely elucidated that well. And so we forget either all of it or most of it. 3 days later, 3 weeks later, whatever it is, you go back and try and retrieve that piece of information. Maybe you remember it at some point, or maybe you have to look it up. But every time you do that, the theory is that the synapses of that piece of information get stronger and stronger. So it's just like training in sports, right? You take breaks, you have phasic training, you work super hard, then you take a break and you kind of let your body kind of fall back a little, recover, and then you train hard again. And that's the same thing with using your brain. The brain's not a muscle, but it responds in a very similar way to how our muscles respond. And I don't think these tactics and techniques are challenging or difficult. You just need to be aware of them. And I think in medical school, because there is so much information, that often we just find ourselves memorizing, when it would be in the long run it would be more advantageous to try and understand, have a deeper understanding, and see the connections in these things. Sure, I love your tagline about the Kreb cycle. Right, we don't need to memorize every element or every compound or chemical in the citric acid cycle. We could look that up, but to understand where its role in, how it connects with glycolysis and how its role into producing glucose and energy and ATP for us, that's really critical, because when you have a drug that inhibits the TCA cycle, now we understand the mechanism of that drug and why it's given and what it does. And that's the lasting knowledge and how we could connect things to one another.
Appreciated. So, but we are sometimes called upon for this rote memorization, right? Like, it would be ideal if that wasn't the case, right? All this minutia that we could look up at we have our computers at our fingertips, our phones at our fingertips. When I was a medical student, they made us buy a PDA. I think it was like a Palm Pilot.
That's right.
Right? They made us, that we never used. We never opened, like they never opened it up. But now we have all this, on our phones and our computers at our fingertips. So when there is a role for memorization, do you have any tips or tricks for that?
I don't think I have anything unique that other people aren't aware of. There's lots of great memory pyramids, I think they're called, memory castles.
Oh, memory palace. Yeah.
Memory palaces. Yeah. That idea, like when I interact with those types of strategies, and that makes sense to me, right? In medical school, some of the things that are most vivid to me are, clinical microbiology made ridiculously simple. That book, to this day, right, I remember so much of it. And I think it's about, the memorization part is relating things. But here's the issue. when we talk memorization doesn't go into long-term memory. Most of memorization doesn't go into long-term memory. There certainly are things, but then it's no longer really memorization. Then it's really association. Somehow, whatever it is, whether I could recite all of the states in alphabetical order, and I could probably do it under a minute due to a song that I learned when I was in like fifth grade. So I memorized it at that time, and now somehow my brain has put it in its long-term memory. I think as physicians or anyone, if we're called upon to memorize something or to regurgitate just this obscure, rare knowledge, we either know it or we don't know it. But I think the key takeaway is that it's okay to say we don't know something. I think that's more powerful. And I think from the patient standpoint, how we deal with that to say, you don't know, you don't know what the answer is, but I'm like the classic, right? I'm going to let you know. I'll get back to you on that one. Is probably the right way to go with that. And if you're doing the work, if you're truly engaged and at the physician level where we need to be experts in things, my guess is we probably do know the questions that are being asked by patients, and we probably can recall almost everything. If we're in a conference, I think people would totally understand if you can't recall something. There'll be someone in the audience that could help out, I'm sure.
So what about teaching, right? Because Rosh Review was recently acquired by Blueprint, who has a cadre of MCAT instructors, right? So what are those instructors, or if you had instructors as part of your program, what are they being taught about teaching techniques, right? Because we're often called upon to be in that role.
Yeah, teaching, again, just like learning, there's lots of different techniques that work. And when Blueprint was founded, it was the idea to kind of move away from the rote, the lecturer just standing up and going over lecture notes. And I think probably most of education has moved away from this, but surprisingly, I still see it more than I would like to. The Blueprint educators and teachers, their real focus is how do you make the interaction enjoyable, lighthearted, bring in comedy. Blueprint is a Los Angeles company. It's an LA company. They have videographers lining up, right? There's Hollywood is right there. So they are easily able to harness those resources to combine with their ability to, first of all, they have real command of that material. So you have teachers who may not truly grasp a concept and have a hard time explaining it, but by explaining it, they'll get better. When we identify who's going to be a teacher at Blueprint, just like a question writer, author at Rosh Review, we look at what's their experience teaching, what's their experience with how well they've done on standardized exams so that they could have a real grasp. Doing well in a standardized exam, though, doesn't mean you're going to be a good teacher, right? No way. So they go through rigorous they do the teaching, they get evaluated, and then they become a teacher. I think the key is engaging students, keeping your sessions to a digestible amount of time where the information is digestible in a certain amount of time. 20 minutes, take a break, another 20 minutes, take a break. You just want to think about, we know that people's attention span starts kind of drifting away if you don't change up the what's being communicated. In 20 minutes, you're going to start losing people. We should probably transition to something, because I'm going to start losing people, because we're probably about at the 20-minute
We're
mark.
at 20. I was thinking the same thing. We're at the 20-minute mark right now. So you mentioned, okay, so when you're teaching, you said using humor to keep people engaged, or any way you can keep it lighthearted and engaging, and also keeping it in small enough nuggets before transitioning to make it all digestible. Anything else that you'd recommend to keep the audience engaged?
Yeah, we use, a lot of animations, right? A lot of visual diagrams so that the speaking or the teaching itself is reinforced by a whole nother part of the brain that's seeing relationships through graphics, through illustrations, through animations. And I think the combination of that is extremely powerful because that starts now, people start being able to recall those types of that type of imagery, and it helps them when they leave that lecture, when they're studying on their own, that it's something that stays with them much easier than 10 minutes of a lecture on complex material. Yeah.
Are you still practicing right now?
So I practiced up until 2019, and I stopped practicing because I ruptured my bicep tendon in my left arm. So that was the reason why the first time I ever stopped practicing. I was taking a car carrier off of my car, and there was a pair of skis in it that I didn't know was in it. And I knew right when it happened, I knew exactly what it was. Didn't go to the ER because I knew there was nothing in the ER anyone could do. But I did have surgery on it, and I repaired the tendon. And then physical therapy was about 6 months, and I haven't gone back since then. So my sole focus, which was very interesting, up to that point, I was balancing my time between being an educator, working at Rosh, running a company, and working clinically. And now my sole focus is being an educator and helping to really, how do we take Rosh and take advantage of all of the support that Blueprint has been able to provide for us.
So while you were still practicing and involved in educating, was there anything that you learned about teaching techniques that translated into patient care, right? How to communicate. I mean, I don't think you're going to have animations when you're explaining things to patients, although I think there are some programs for iPads out there. But anything that you learned about being an effective teacher that translated into being an effective teacher to your patients?
Yeah, no, I think you touch on it, right? I think so often when I see physicians, and being a patient myself, or my child being a patient, or my wife being a patient, right? We're attuned to what's happening in that transaction of knowledge, right? Where I'm watching physicians and how they're communicating. And sometimes you come across ones where you say they get it, and other times it's really disappointing. I think it's challenging no matter what as a physician, because our time is limited, and there's a lot of pressures today than there were probably 20 years ago. But using techniques as simple at the bedside as diagrams, as stories, as relatable examples, all work super well. It's easy for us to speak in the scientific language, in the medical language, but we forget, right? We have the curse of knowledge. We forget that our patients know nothing about what we're trying to tell them. And it's the same thing with students. We have a curse of knowledge in that we assume often that our learners are understanding the things that we are taking for granted in that understanding. And so just recognizing that and being able to start with the fundamentals of anything you're trying to learn, the building blocks of these things, and to use relatable examples to Try and find things that that they understand, with patients. Just, instead of talking about the heart, talk about a pump, a water pump, right? Talk about a sink with water in and water out. That makes things make much more sense to our patients. And in teaching, it's the same way, right? You could use similar examples in how we teach.
Excellent. Well, I'm sorry about your bicep tear, but it sounds like it helped you transition right at this point in your life to what you're doing. Any parting words for the audience on either learning or teaching or setting up a business?
I think since a lot of what you talk about in your podcast is how do we really live a full life, and getting to the point of being a physician, it was a huge sacrifice for a lot of people. It's a huge sacrifice for everyone, I mean, and I think people who, whatever reason that they want to try something new or try and accumulate, get some income from somewhere else or change their jobs, so often, and I hear the same thing. We hire physicians to work at Rosh Review and Blueprint. A lot of them are full-time, a lot of them are part-time, but many are full-time. And it's the same story. And it's usually about 10 years out, right? You start getting burnt out. You start not loving what it is that you signed up for. And there's a lot of fear in making that next jump because you've invested all of this money. You may even still be paying back student loans. You have probably a couple cars, a bigger house, kids potentially. And you start it becomes you have a lot of fear, and that's normal. And that is completely normal. But what I could tell you is you have all of the tools. Your utility belt is ready for anything. When you get into medicine, you've gone through rigorous years in undergrad. You've studied for an MCAT. You've gone through an interview process for medical school. You've spent nights studying in medical school. You've gone on an interview trail. And in residency, you make life and death decisions. You are the number one person to now make a decision for yourself to go out and try something that maybe you've always wanted to do, right? How are you standing in the way of achieving what you've always wanted to achieve? And that's a really important question to ask. How are you complacent in not getting what you want? When you start asking that question, things become clearer, and it's just a leap. There's nothing on the other side of fear. Fear is an emotion in our mind. It's real in what we feel, but it's just an emotional feeling. And so I think we're in a very challenging environment in healthcare. I'm super grateful for all of the people that have stood by my side, that have supported me and given me advice. And so for your audience, there are people out there who are there to help, that are rooting for you, that will mentor you, that will teach you from the mistakes that they've learned and that they've made. And I know that was my case, and I know I've made many mistakes that I could certainly share some wisdom from. And just grateful to be able to speak with you, and look forward to listening to many more of your podcasts.
Well, fantastic. Adam Rosh, Rosh Review, also available now at Blueprint. Thanks so much for your time.
My pleasure. Thank you.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on The Physician's Guide to Doctoring.